Good evening, everybody. My name's Michael Harper. I'm the Chief Operating Officer here at Sheffield Teaching Hospitals. Really want to thank you for taking some time this evening to join us for this event. This is the first time that we've done this, so really pleased that you've joined us. I've been working here at STH for 22 years now. My first role was in the Accident and Emergency Department at the Northern General, and that's where I first started working really closely with the receptionists, in particular in A&E, and saw the fantastic impact that those people had on our patients and their relatives when they were in need of their care. So I'm really pleased that you're interested in picking up a role like that. As the kind of professional lead for admin and clerical staff, sitting at the board as I do, it's really great, and I'm really pleased to have this opportunity to bring along the team that we've got here at Sheffield Teaching Hospitals to tell you about all the different roles that we've got here at the Trust. We are the largest employer within Sheffield. We're really proud of that, and that does mean that we've got lots of jobs, lots of opportunities, lots of different ways that you can get involved in working for us. Tonight, what we intend to do is talk through the importance of admin and clerical roles in providing patient care, to tell you a bit about how they make a difference for our communities, for our patients, for the people that work here, and for the care that we try to provide to over 2 million patients each year. We also want to give you a bit of a flavour about the benefits of working at STH, and how, hopefully, when we've told you about those posts, if you're still interested in applying, how you can go about doing that. And finally, before I hand over, I thought it might just be helpful just to kind of give two personal perspectives on admin and clerical roles. So my dad was a milkman for 15 years, but unfortunately had to stop being a milkman because he needed both his hips replacing. And after that, he came back and he was a receptionist on the medical outpatients over at the Hallamshire Hospital. And he loved working there. He used all the skills that he'd got from doing his milk round in terms of working with people and communicating and helping folk. And my wife is a nurse at Weston Park Hospital, and she works really closely with Tom, who's one of the people who you might have seen on the flyers. He was at the Sheffield Wednesday Football Academy. He went off and did a sports science degree, and from there he came into working as an admin and clerical person really closely at the chemotherapy unit at Weston Park. So we do have lots of different people from lots of different backgrounds bringing lots of different skills into our roles, and we really love that. That's what makes Sheffield Teaching Hospital so special. So really pleased, hope you stick with us and hear about it today. There is an opportunity at the end to ask some questions, so please feel free to do that. So I'm going to hand over now to Jo Marsden, one of our nurse directors, who's going to really talk about how admin and clerical staff support our patients. So over to you, Jo. Thank you.
Thank you, Michael. Yeah, my name's Jo, and I'm nurse director in surgical services in the Trust. Thank you so much from me too if you're interested in an NHS career in Sheffield. I'm really lucky and very proud that I've been a nurse in Sheffield for 37 years. I love my job, always have, and the diverse group of people I work with. In that time, I have witnessed teamwork at its absolute best, even in the most difficult times, and there have been a few of those recently. In the NHS, we are one big team. All of us rely on others to help patients and their families have the best care and the best experience. None of us can do this on our own. Admin and clerical teams play such a significant role, and the roles are so varied. Face-to-face with patients such as ward clerks and receptionists, on the end of a phone liaising with and supporting families, making sure that letters, appointments and referrals are all in place, or even a bit more remotely, supporting us by helping us to look at data, information and trends that help us improve services. People who work in these teams develop skills that are transferable, not only in work, but in life. And that's a real honour. That is really something to think about. I've been really lucky to have worked with the most amazing admin and clerical teams who are motivated by the same thing as me, to make sure that patients and their families have the best experience, the experience that I would want for my family. The names of these staff and how they've worked remains in my head and in my heart. And as I look back on my career, I remember examples of their kindness and their contribution. The ward clerk who was so kind and non-judgmental when patients with life-threatening, stigmatised infections were admitted to a ward. The numerous secretaries who've made sure that their contribution to supporting patients on the phone made a real impact on those patients and their families' lives. The MDT coordinator, who was so kind and positive and who we all respected and admired, who put patients at the heart of all their work and had so much empathy. And then now, lots and lots of admin and clerical teams who help me to do my job and help nurses and really put patients at the heart. As I look forward and on evenings like tonight, I do take enormous comfort that there continues to be good people interested in an NHS career. I can tell you, if it's a path you choose, you won't look back. The skills and experience you gain would stay with you forever. We're going to hear about people who, as Michael's described, have developed their career in the NHS, but my operations director, which is a senior position in the trust, has given me permission to share her story. She started her career as a secretary, and she said it was one of the best jobs she ever had. And we do look back and we chat about the happy times and the difference that she made to people's lives. She really, really did. To work in the NHS in whatever role means you have a very privileged position. We all here have a very privileged position. The public and people at the most vulnerable put their faith in trust in us, and we really, really do have an opportunity to make a difference. Many of my friends regret that they've not had that experience in work. Many have earned a lot more money than the people around this table, but they've not had the experience that I've had. And if I'm honest, I'd do it all again. Going back to the young Joanne Bell that started in the organisation, I would do it all again. Thanks for listening to me. I do hope you find this event helpful. I'm very happy to chat at a later date if anyone wishes to contact me. And I'm going to hand you over without further ado to Paige, who's going to talk about her experience.
Thank you, Jo. Hi everyone, my name is Paige and I am an administration coordinator within facilities services, and I work across site at both Northern General Hospital and the Royal Hallamshire Hospital. Facilities services is a large non-clinical directorate and it's responsible for providing all domestic and cleaning services, catering, retail services and waste management across all sites. The directorate also consists of security services, linen services, portering and transport, and we have up to 1,400 staff within our directorate, so it is huge. My role as admin coordinator includes assisting HR with the recruitment of new staff within facilities, and I produce weekly and monthly reports for outstanding appraisals for all facilities departments for the higher management team. I also manage a small team of admin staff, and the team is consistently growing to match our ever-growing workload, and it's really exciting that that's happening, that we're expanding a huge admin team for that directorate. The team and I manage senior managers' diaries. We produce minutes from senior team meetings, and we're responsible for inputting data on numerous systems. We assist our managers by transcribing sickness letters for staff, and we complete paperwork for payroll services, and that can include term time contracts, parental leave forms and reduction or increase in hour forms. I think the best part of the job for me is knowing that we are providing a good service to our patients and staff. Whether admin are booking transport for patients or whether we're providing our staff with health and wellbeing information or assisting managers with their work, we're providing a service, and to me that is why admin is so important and it is fundamental for the hospital. And admin can also be a great career path, and because of the support I've received from my managers, both past and present, it's helped shape me into the manager that I am now. and I can offer that same support to my team to help them pursue their careers. I'm a huge advocate for the admin sector, and particularly during the pandemic, admin teams were crucial in supporting nursing teams, the support workers, and helping get the vaccination centres up and running. And I am really proud of the admin team who were involved in making that happen, and it made me proud to be admin. It was really, really good. Before I came to STH, I worked in the hotel industry for about 8 years, and I had progressed in the hotel industry, but in the end, it was the work-life balance that didn't suit me. I would start work at around 7 in the morning, not get home till about 11:30 in the evening, and that could be 6 days a week. And even on the one day off I had, I found I was still working, whether that was checking emails or making business phone calls, and it became quite unhealthy. So in late 2018, I decided I needed a change in career to try and find a better work-life balance. I looked at jobs all over online, and one thing that stuck out for me was NHS Jobs, and they had an admin and clerical bulk recruitment going in 2018. So I applied, and I started my STH journey in December 2018 as a clerical officer at Jessup Wing Hospital in antenatal outpatients department, and they focused on booking patient appointments and prepping patient notes for clinics. Within a year, it was around 10 months, I actually progressed and became matron secretary at Northern General Hospital, providing admin support for 6 matrons and other members of the senior nursing team, including the nurse director, deputy nurse director, governance team and senior sisters on the 11 wards that they manage. During my time as matron secretary, I applied for a 6-month secondment as administration officer in community therapy services, which gave me the skills in business reporting and data inputting that I needed to be able to secure my current role. The secondment opportunity I found was very beneficial, and these opportunities come up quite often within NHS, and they're fantastic to gain extra knowledge. Even if you are on the same sort of salary, you can sidestep, get that extra experience and look at different ways to develop your career. Without the encouragement of my matrons, I wouldn't have applied for that secondment to be where I am now, so I am really grateful for their support. In STH as well, we're really passionate about health and well-being of our staff and patients, so in addition to my role as admin coordinator, I've since become a wellbeing champion, providing health and wellbeing support and information to staff. And more recently, I was successful in securing the role as co-chair for the Women's Staff Network Group. STH is brilliant for the staff networks that they have, and Women's Network is a new one, and we are developing, but it's really good to know that we can make a difference, not just in our role, but in other ways as well, such as wellbeing champion and with these network groups. Throughout my time at STH, the support I've received from all my managers has been exceptional, and it's a special mention to the Facilities Directorate, who have really helped and invested in my career. I've been here just over a year, and thanks to them, I am currently enrolled on a Level 3 Business Administration apprenticeship, and on completion, I'll be looking to enrol onto a 3-year degree course in Chartered Management, which will help me progress to a more senior role, and I'm really excited for that. But without their encouragement and their support, I wouldn't have considered applying for an apprenticeship, let alone a degree. Any training that I feel I want to go on, I'm always supported, and I'm really grateful for the team and the managers that I have, because they are all supportive and we all have one common goal: we want to provide a good service for our patients and staff. I really would recommend an admin role in NHS, because all the opportunities you are given, from education and training to the secondment opportunities that I was lucky to have, it's really helped me progress. And I've not even been here 4 years, and I have moved up on the ladder, and I've got a good career path thanks to the support of my managers. Thank you for listening to me. I am now going to hand over to Claire Shephard, who's had tremendous support as well, getting into a senior position.
Thanks, Paige. So I've been asked to just give a little bit of a whistle-stop tour to my career in the NHS. So currently I'm the service manager in general surgery. I started with the trust in 1999, just as a job to get a little bit of pocket money while I was at university. So I was studying French and Spanish at university. I subsequently went on to do a master's in translation because I had the intention of becoming a freelance translator, but it was a little bit of an accidental career in the NHS. I got hooked and never left. So I had various roles over 12 years in neurosciences. So clerical officer in outpatient, so making appointments for patients, a medical secretary to neurosurgeons, and then service coordinator, which was my first sort of management role. And around this time I started a master's in health and social care leadership. I was really lucky. This was funded by the trust, and I was granted the study leave to complete it. So I actually did leave the STH for 3 years and went to the Children's Hospital, but returned 3 years later, as I said, as ops manager in urology, because I wanted to come back to previous managers who I'd worked with in the past and really respected, and wanted to work with them again. And I think, why do I love working for the NHS? I think the patients are the heart of everything we do. You can really make a difference working for the NHS. First and foremost, I'm so passionate about patient care, and every single patient that crosses my desk, you just want to get a great sense of satisfaction for helping them and their families progress through the journey in the NHS, and it's really rewarding when you can help patients and families through their journeys and make a difference. And I, always go the extra mile to help patients and families. What I also love is no 2 days are the same. You're always learning. There's so much variety, and I love working with the wider team. So working with different professionals, and everybody comes together to provide the very best service that we can to our patients. And that's what it's about for me. And also, having worked at STH, I've made friends for life. So to say I fell into the NHS by accident, I'm so glad I did, and I've never looked back. I would highly recommend it as a career. Thank you. And now I'd like to hand over to Balbir, who I work with very closely, and she's led the development of a development programme which recognises admin and clerical as a profession and not just a job. Thank you.
Thanks, Claire. Good evening, everyone. I'm Balbir Bhogal. I'm the Performance and Information Director working at Sheffield Teaching Hospitals. Like many of my colleagues that you've heard from today, I've been here within the NHS for 33 years, 25 of those at Leeds Teaching Hospitals, and the last 7 exciting years at Sheffield Teaching Hospitals. And you've heard lots of really positive feedback from colleagues that have been here for many, many years, talking about how important and how rewarding it is to be able to look after patients and to work with other colleagues that care about being in the NHS. I think I'm one of those people, and I'm hoping that there are some people out there that want to come and join us. So admin is not just a job. Working within the administrative profession is an opportunity for you to come and have a really rewarding and fulfilling career. You've heard about a number of colleagues that have done that already. We recognised within Sheffield Teaching Hospitals that there were things that we could do better for people that worked within administration. It's not just us that recognise the importance of people that work in these roles. There was a King's Fund study published a couple of years ago that talked about NHS administration impacting on the way we deliver care for patients. And that study talked about administrative people helping to make sure patients, staff, equipment and information was in the right place at the right time for all our patients and for our staff. So we set up a development programme, and we're working on this at the moment. And it has a vision where whichever part of the organisation you join, whether you want to join a patient-facing role or a non-patient-facing role, supporting clinical teams or supporting non-clinical teams, you can join right at the start through an apprenticeship programme or come into a junior management programme and progress right the way as far as you'd like to go in terms of what you find rewarding and what plays to your strengths and your skills and what you want to achieve. So we're looking at making sure that we've got the right training programmes in place. We're looking at how do we support you in making sure that there are good systems that you've got to work with, and that we give you good quality feedback, and that we look at the development programmes that are out there. I think you've heard from a couple of colleagues the developments that they've been on and how that's helped in their careers and how it's helped them to progress. It's not all about progression, it's about what's right for you and where you want to be. And the only thing we ask of you is you come and join us to put the patient at the centre of everything that you do and join one of the best teams that you could ever be working with. So that's what we'd be looking for. What we do is we celebrate World Administrative Day as a commitment to our staff that work in the administrative roles. We've celebrated that now for 3 years, and we come together, we talk to all our staff and we hear from them. And what we do is we reflect on the number of appointments that we've booked and the number of ward areas that have been cleaned and the number of contacts that we've processed, to give ourselves a real understanding of the difference that we make to each and every person that joins Sheffield Teaching Hospitals, and the impact that we have on the people that we're serving. We want you to come and be part of that. We want you to come and join us. We want to hear from you. We want to invest in you, and we want to remind you it's not just a job, it's a career, it's a profession, and it's something that we're sure we can be right for you. I'm going to hand over to my colleague now, Debbie Padwick. Debbie works in human resources and is going to talk to you about some of the real opportunities we've got and how we access our services and how you can come and join us. I'll hand over to Debbie. Thank you.
Thanks very much, Balbir. Hello everyone, I'm so pleased to be able to be here tonight with colleagues to talk to you about this really important part of the workforce. Working in HR, we deal with many different aspects of the workforce, but admin and clerical is such an important part. There's so much positive information you've probably heard tonight, I hope, and I hope some of this has been of real interest to you. So I'm just going to underline a few points for clarity. First of all, such a diverse career opportunities we offer across so many sites within STH. And to recognise that we offer that in many ways of working, flexible ways of working, different hours, different days of the week and different patterns as well. So there's lots of choice for everyone. We think that we have very good career structures, and we've heard some of that earlier on in the talk, and there are places where you can find out more about that. In terms of what's in it for you, there is more that we can say about this now. And one of the things I just wanted to spend a moment was thinking about how we reward our staff who work here. This often goes unnoticed, but there are some really good things to say. So we've obviously got our standard rates of pay, which we advertise on the job at the time, but we've got really good annual leave as well. We've got a brilliant pension scheme. We offer career breaks, and we offer many discounts at shops, restaurants and local attractions as well. From joining up to our services in site, then there's many different ways that we can do that. We've got on-site nurseries, one at either side of the city, and a host of training development opportunities for longer term apprentices and career development, as well as short skills courses. And as you said, we do look after you. Our aim is to look after you from the beginning of your career to the end. And what I do know is that we have employed people directly from school. We've employed people from university. We've had people that have left the NHS and come back to us. We've had people that have chosen to take time out of their career and then come and join us as a first job after many years. And we've had people that are nearing their retirement but want to contribute to the NHS. So we do believe that we can offer a variety of careers for a vast number of people. And that's what we'll ask you to take away and think about from this session, really. So in terms of what the next steps are, we want to make this as easy as possible for you. We don't want to put you off with any barriers or thinking about how to apply. And there are ways that we can do that. We do have within our trust people who are specifically here to help you talk about your career, if that's what you'd like to do. We can help those people who feel that they're not sure that this is the right career for them to get back into the NHS or find their ideal opportunity here. We can assist you with that. If you're thinking about some of the issues around perhaps English language access, etc., again, there's conversations to be had there. At the end of this event, we'll show you an email address where you can contact us for further information. And we will also be sending you out a bulletin as well, so you can apply directly for those jobs if you want. But please remember that we are here to talk, we are here to share, and we're here to help you find the right pathway into STH for you. So much to offer, and I do hope that we've been able to show you an insight into what we've got. So just in summary, in terms of the jobs that we've got receptionists and ward clerks, we've got personal assistants and project assistants, booking clerks, and we've also got many more out there in other corporate departments within HR, within finance, within our procurement team. The list is really endless. So if you'd like to give that some thought, we'd be really happy to hear from you. We'd be really happy to learn some more about you as an individual, and you can do that by emailing us at the email address that we've provided. We'd love to hear from you. I think we're going to take a few questions, and it's back to Balbir.
Thanks, Debbie. So we've had some excellent questions posted in the chat, and I've just scanned through them. A lot of them, Debbie, look like they're going to come your way, if that's okay. And some of them may have been answered within your section, but I think for clarity for the kind individuals that have posted them through, I will ask them again if that's okay. So the first question is from a colleague that's come here from the Ukraine. And English is not their first language, but they're currently studying the ESOL level 1, but he's keen to have a career within the NHS. Are you okay to give us a steer in terms of sort of next steps for that individual?
Yes, thanks, Balbir. Yes, we'd be happy to have a conversation. First I should say, we've got an employability manager working with us in the trust as part of our learning and development team, who can provide specific advice on accessing English language and developing English language skills and linking that to career opportunities. So we'd be, I guess, happy, best way to do that is to have a conversation on a personal basis. So you contact us via that email address and we can make arrangements to contact you and put you in contact with the right person to give you that advice.
Thanks, Debbie. The next one I thought probably did feel like it should come to you, Debbie, which was some advice on interviewing, perhaps for the bulk recruitment process, and any tips. And I don't know if other colleagues recruiting managers want to chip in, but I'll start with you, Debbie, if that's okay.
Yeah, thanks. So the first thing is be yourself. That's what we're looking for. We're not out to try and trick you. We want you to be reflective of the job that you're applying for. Think about, as we said, putting the patient first. This is what we do. Think about reading the job description, but particularly the person spec. The person spec sets out the sort of person that we're looking for. So give that some thought before you come into the interview and think about those are the questions that you'll be asked around that person spec. That's the sort of thing you'll be asked, and that's what we're really hoping to talk to you about when you come for interview. But no trick questions. It's a completely transparent process.
Yeah, and Claire, did you want to add anything, given that you tend to be involved in that part of the recruitment process as well?
I think sort of historically we've always been really keen to say that, you know, candidates need to have an NHS experience, but I don't think that's the case. I think people have, you know, got really transferable skills from other roles outside of the NHS, and I think that's what we need. I think we need people with an objective eye, an objective opinion, and everybody brings something different to the table. So I think it's really important that, you know, that candidates don't think, I've never worked in NHS before, so I can't apply. I absolutely encourage those people to apply.
Okay, thank you, Claire. That was really helpful. Debbie, another one for you, if I may, and this is an individual asking about being able to forward their CVs for us to peruse rather than them picking out jobs that are suitable. And I suppose one of the things that we've discussed today has been there's just so many diverse roles within the NHS. Maybe what we can do, and at STH, maybe we can help individuals and signpost them. So any thoughts on that, Debbie?
Yeah, that's a very good point as well, isn't it? Because absolutely, when you look at our website with the jobs on, you will see lots of jobs there. What we do with admin and clerical, we have a process called bulk recruitment, which is where we advertise a whole host of jobs and we put them together under one umbrella. So you apply once and then we match you with your perfect fit to the base you want, the hours that you want, etc., etc. But as we're doing this in this kind of setup, in this arrangement and reaching out to you today, what we are saying is, again, through that email address, if you want to have that contact with us directly, we can offer that specialist support right here following this. So yeah, happy to follow up any conversations afterwards on this basis.
Okay, thank you, Debbie. There's one that's talked about positioning themselves and how best to bring themselves back into the organisation. I'm hoping that Claire's and Debbie's, you know, be yourself, be authentic, bring your skills into your application would be what we'd be looking for at that point in time. And there's an individual that's asked us about not wanting to answer the telephones, but wanting to come and do other types of administrative roles. I'm hoping that the list of roles that we've advertised give you a feel for the different types of jobs we've got open and available. Debbie, did you want to add anything further on that?
That is a very good example where I can say, you know, we can match people to the perfect role, really, and there are jobs that we do have that would meet those conditions. So again, tell us some more and we'll be happy to have a chat with you. So use the email address and, you know, we'll follow that up with you.
Yeah. And there's a cluster of questions, Debbie, that are around people have applied previously either to the NHS or to the Trust and haven't been successful. Do you think there's an opportunity for them to open up a dialogue with us to work out what it is that we're not spotting in their applications?
I think so. I think this is the ideal opportunity to do that now, because what we have arranged behind the scenes, so it won't just be HR you're talking to. It's my colleagues, it's our people who will be shortlisting and interviewing to give some advice and constructive advice, or perhaps our learning and development team. So there are people out there who are really able to assist and to help you with coming forward and talking to you about making an application. So yeah, this is the time to do it if that's okay with people out there.
Yeah, thanks, Debbie. That's really helpful. A similar theme for a cluster of questions here that are around sort of the level of experience that people are bringing, and some are school leavers and not always kind of lots of qualifications. I think you touched in your presentation around apprenticeships and different routes, and the opportunity, even with school leavers, for us to invest in their development. Debbie, you happy to take that question?
Yes, thanks. I think the opportunities for apprenticeships at STH has never been so great, actually. We've got such a vast variety, and I can see Paige nodding there enthusiastically, because I think it's very true. We are starting people here on now out on really good careers for the future, and so please do give that some thought and consideration. We've got specific information which we can send on to you about the variety of apprenticeships we've got here if people are interested. So again, please use the email address and we'll be happy to send on further information on that basis.
Just to sort of jump in there, if it's okay, we've had some apprentices within our directorate and within our care group who, you know, they've shone from day one, and then they've gone on to substantive posts. So absolutely, it's a great way to get in to the NHS. It's really recommend it.
Thank you, Claire. Thanks, that's really helpful. And just one final practical point, and then I've saved a question for Michael, if that's okay. So Debbie, there's a question in the chat that asks about if somebody approaches us, would somebody get back to them in terms of potential vacancies? And for example, audio typist. I mean, I know that we have a shortage of audio typists, so whoever that is in the chat, we'd like to hear from you. But in terms of our process, Debbie, do we have a good process at getting back to people?
We've specifically set this process up here now so that people contacting us and using that email address, we have now got a structure behind that where we can respond to everybody and try and understand what you're looking for and where best to match you. So please come through to us on that basis in the next few days, and we'll be happy to have that response with you directly.
Okay, thank you, Debbie. So Michael, I was going to hand the last question to you, and in that process kind of hand back to you to do the wrap up at the end of that question. So there's quite a theme of people describing the variety of experience that they've got, and the one I'm looking at the moment, we've got an individual that's worked in a charity for over 20 years, but equally we've got people that have got very limited either qualifications or experience, and there is a question at the bottom, how do we apply? So it's what are we looking for, what do we want at STH? And I think there are people that are saying that they'd like to come here, so over to you, Michael.
Thanks, Balbir. I think what are we looking for? You hopefully will see the background that a number of us or all of us have got. Describe what we call STHR proud behaviours, and the proud stands for patient focus, about respecting one another, whoever that is, about ownership of seeing tasks through to the end, owning the problem, owning the solution, about unity, so working as a team, working with our patients and relatives, working across the system, and delivery, so delivering what we all strive for, which is great patient care. So we're really looking for that set of values. And I think in particular, we're looking for someone that if you were picking up the phone to ask about your appointment, or you were arriving in A&E, or you were in a community setting and looking for someone, we're looking for someone that you would feel was looking after your care, was listening to you, and was making sure that the next step of your process is absolute and your pathway is absolutely complete, and you've got confidence in that. And as my colleagues have described today, the opportunity to do that, whether it's front of house, on a reception desk, on the end of a phone, or behind in one of the many very different departments that we've got, not only in clinical areas, but in facilities, as you've heard from Paige, or security, or our estates, supplies, finance, human resources. There's lots of opportunity. So the people we're looking for are the people that are the skills, people with the skills that we've described here, but more important than that is the values. And so just kind of summing up then, and thanking you, I really would like to thank you for taking the time this evening to come on the call and listen to us. I hope it's been helpful and informative. I think the three things that I'd like to really just underline that colleagues have described are the opportunities that we have got at STH. There are challenging jobs, they are a variety of roles, and one of the things you might be worrying about now is, gosh, which one do I pick? And hopefully we've reassured you that we can help you with that and look at that. There is the opportunity to progress or not, dependent on what you want to do, but there really is an opportunity every day to make a difference for our patients. So opportunity. The second thing is flexibility. Clearly we provide services to meet the needs of our patients, but we are so big, we work across acute and community. There is some flexibility about where you work, when you work, and the type of work that you do. And again, we're keen to work with you about how we do that. And finally, and hopefully you've heard it, just how colleagues have described just the opportunity for this being a rewarding job and a rewarding career. We've described the salary and the benefits. There is security within the NHS, and there is that absolute opportunity and reward of helping patients and working within a team. So we hope that opportunity, that flexibility and that opportunity to be rewarded has been described tonight. So thank you all. We've provided the opportunity in terms of the website and the email address. Do look at both of those. Do get back in touch, hopefully to apply, and hopefully we'll see you around and about with an STH badge on within the next few months. Have a lovely evening and hope to see you soon. Bye bye.